So hey everyone, good day to all. Myself Dr. AJAY Maurya. From today onwards, I'm going to start the series of the 10 by 10 series. That is 10 topics, and from each topic, we are going to get the one MCQ per sure. For the PDF guys, the link in the description for the PDF guys. Okay, so this is going to be the first topic. Is about the management of the ischemic and the hemorrhagic stroke. Okay, so see here, guys, how we are going to differentiate between the ischemic and the hemorrhagic stroke. Ischemic is what, guys? When there is a decrease in the supply of the when there is a decrease in the supply of the blood and also the oxygen to the brain, so there is going to the necrosis. Okay, so guys, the ischemic stroke, it may be thrombolic or embolic. Okay, so the hemorrhagic means what about? There is the rupture of the blood vessel in the brain. Okay, so see how you are going to manage the ischemic stroke here. See, actually, when I was in the casualty as the intern in the general medicine casualty, in the Sunday, uh, a patient came to the casualty with the chief complaint of chronic headache. Okay, so chronic headache. So upon examination, first of all, I have to monitor the vitals here. Her BP is 180. So we thought that okay, because of the BP only, high BP only, she might get the headache. But what happens is that on examination, she have what she have focal neurological deficit. Focal means what? Means there is only one region, okay, in the brain. See what happens here is there is a paralysis, there is a unilateral paralysis of the lower limbs, guys. So she can't raise her hand also. There is a, I said to talk anything, but she's having difficulty in the speech also. And upon examination, there is a angle of deviation. Her mouth, what? Angle of mouth is there is a deviation also. So by this, guys, we thought that okay, she might be what she might be how the chance of CVA. Okay, so investigation. So first I check the GRBS, guys, but her GRBS is normal. But first investigation is that we did is the NCCT. So upon NCCT, if there is no hemorrhage, guys, then if there is no hemorrhage, then okay, it might be the case of the is going to be the favor in the ischemic stroke here. So in the NCCT, first of all, then we did the MRI. For the MRI, for the localization, guys, either the chronic infarction, either the thalamus or ganglion, something. Okay, so you have to know the location of that infarction here. Okay, so how we are going to manage the patient? So actually, most of the cases we are getting in the casualty, guys. They will come after 24 hours, after 48 hours, after 3 hours, or 3 hours, after 3 days only. Okay, actually, no one is aware of that one, of this one. If the patient is present within the 4.5 hours, then we have to plan for the thrombolysis for the drug that altiplase, which is the alti altiplase, which is the reverse tissue plasminogen activator here. The dose is 0.9 mg per kilogram. So first of all, guys, we have to do the first there is 100% 100 ml. It means first 10 ml you have to give as a start dose, and remaining 90% you have to give as for the over 30 to 1 hour before. Then, and also, guys, please do not lower the BP as it decrease the blood flow to the brain. As I said that the main reason is the decrease in the blood flow. That's why, guys, do not lower the BP. You must maintain at least 180, 170. Okay. What are the indications for the thrombolysis, guys? Okay. See, yes, if the time is how much? Time is less than 4.5 hours. Age must be more than 18 hours. Contraindications, however, more than if the BP is more than 85, then you have to not do the thrombolysis. You have to must be less than 185. So first of all, you have to decrease the BP by using IV labetalol. Okay, now if the infarction is more than 1 by third part third strategy of the MCA, cerebral artery. If the infarction is larger size, then also you have to do not do the thrombolysis. What if patient came? What if patient came after 4.5 hours to 24 hours? It means then what you have to do is then you have to do the mechanical thrombectomy. Means using some devices to break that thrombus. Okay. What if the patient come after 24 hours? Yeah, this is the general scenario, as we are seeing in the ward, in the casualty ward, how the patient is presenting. For this one, guys, there is a you have to give the dual antiplatelet, that is tablet ecosprin 150 milligram, clopidogrel 75 milligrams, and the atorvastatin 40 milligram. That is this triple these three drugs you have to give as the start dose, and you have to continue. Okay, this is how you are going to manage the ischemic stroke. Coming to the hemorrhagic stroke, guys. Okay, it is due to the uncontrolled hypertension. What a chief complaint is the altered sensory, and there might be a seizure also. First investigation you do is the NCCT of the brain, and followed by the, so in the NCCT you will see there is a bleed. Okay, so management, it is due to it is due to uncontrolled hypertension. That's why you have to, first of all, you have to decrease the BP. That's more than enough. Okay, so control the BP, and the patient will also have the seizure. That's why you have to give the anti-seizure medication such as the levetiracetam, okay, diazepam, etc. Okay, done. See here, what is TIA? Transient ischemic attack. See, if the patient is recovered, suppose the patient is having the focal neurological deficits such as there is a unilateral paralysis and something. If the patient recovers within 24 hours, it is called as what? Transient ischemic attack. Transient ischemic attack. Okay, now 24 hours. Okay, how this patient is going to recover, because we are having the natural anticoagulant in our body such as protein C and protein S. These will help us to recover from the from the ischemic attack. If these protein C and S will fail, then we'll get the stroke. But if you get this TIA, guys, you will have the risk of the future stroke. Then how we are going to assess that? If you are then how you are going to assess that you have the risk of getting the stroke? We have in the ABCD2 score. Okay, so age means age must be more than 60. Then you have to give 1 point. B for BP, SBP is more than 140. You have to give the one score. Clinical features such as unilateral weakness without speech is 2. Speech impairment without unilateral weakness 1. Duration, like that one. You have to. These are the points you are getting. If this is 3, it means you have the low chance of getting the stroke. 4 to 5 moderate, more than 6, it is the high chances. So that's how you are going to clarify to the patient. Okay. The next one is the types of seizures. First one is the GTCS. GTCS means what? Is also called as grand mal seizure. Also called as grand mal seizure. What is grand? It means grand means grandma. Between grandma, it means old. Grand means old onna, means old children. That is most common in the adults. So more than 17 years old guys, we will get the GTCS. First, suppose example, suppose this guy was eating in any function, in any marriage function, okay, and suddenly he fell down and he get the tonic clone. He's getting the tonic, and it means what? There is a what means there is a, first of all is the he will fell down. That is, first is the loss of the consciousness. The second stage is the tonic stage, means all muscles will get in the sustained contraction. He will just fell down, and he will beat his, sometimes he may bite his tongue, and he may like do that like dancing type of, like he will just extend and flex his he will do the extension and flexion of his hands, like that one. Okay, he'll get the contraction. I think you guys saw the movie, there's Raja Rani. Okay, in that there is Nayantara. She'll get this GTCS. Okay, third is the clonic stage. It means all muscles will contract and relax multiple times. There is also amnesia. That's why see when this patient got GTCS, if you ask what happens, he'll tell, I don't know, I can't remember. Amnesia also. See here, see if the GTCS is more than 5 minutes, it is called as status epilepticus. It is called as what? Status epilepticus. Okay. So see here, actually, what is the treatment for the status epilepticus? It is the what IV lorazepam. See, what is the standard drug of choice for the GTCS? It is the valproic acid. It is the valproic acid. But as you know that if the female is pregnant, so valproate is it is very teratogenic. It is very teratogenic. Okay, because it causes the neural tube defect. Okay, see here we are having the two scenarios here. The first one is if the patient is, suppose example, female want to be pregnant. Suppose example, there are two females here. There are two females. Okay, one female is she is well educated. One girl is not well educated. So she know that if I am using the valproic acid and I am planning for the pregnancy, she knows that her child might be get affected. That's why he will come to doctor. I will say, and she will ask you, doctor, I am planning for the pregnancy. Should I continue the valproate? He will tell, no, beta, no. You have to stop the valproate and you have to use the levetiracetam. Suppose another woman, she is not well educated and she having the GTCS, she is continuing the valproate, and again she after for that after 2 months she came for the ANC antenatal care, and doctors asked her, what are you using? She tell, I am using valproic acid. She tell, okay, please do not stop it, but you have to add folic acid, okay, for the, okay na. So for the, for to avoid the NTD, okay na. Done. Next, there are seizures, infantile spasm, a salam seizure, severe. This is also called a jackknife position. Okay, na? Treatment is the ACTH. Jan syndrome, myoclonic epilepsy. It is what in the question, guys. They will see that in the early morning, while wake up, she will get the what? She will get the bilateral myoclonic jerks. That is called Jan syndrome. Okay, na? The treatment is the valproic acid. History will start at the morning, at occur in the morning, okay na? At morning time in the children's only. Subtle seizure, I think you know, this is the most common in neonate. Treatment is the IV phenobarbital. Febrile, I think everyone knows about that one. The 6 months to, the most common is the 6 months to 6 years. Yes. Drug of choice is the rectal diazepam. The prophylaxis is the clobazepam. Absence seizure, petit mal epilepsy. That is the what? Petit mal what? You see, absence is a pretty much seen in the case of the school going children. How they are going to tell the, suppose example there is one guy. Suppose example there is a one child of 15 years old. So there is a one guy. He is 15 years old and he is having the poor academic performance. He is having the poor academic performance, and many and his parents gave complaint to his class teacher and class teacher and to the principal that he is not active, he is not more active, he is always sleeping in the school. It means, guys, what happens, he suppose example he was he sat in the he's sitting in the classroom and the teacher is telling about something. He will say everything, but whenever the children, okay, Ajay, he will not listen because under what he everything is a blank. Na child will blank in the classroom only. Okay, na he will, okay, and the child is very unresponsive. Okay, that is the absent seizure. If the children is the less than 5 years, drug of choice is the ethoxamide. More than 5 years, it is the valproic acid. Remember this one. The next one is this was the candidiasis trichomonal vaginitis bacterial vaginosis. See how we are going to remember the trichomonal vaginitis. See here, there is a one trick here. Okay, suppose example C. See, see here, this is a train. Anko, okay? This is a train. See, I went to buy. See, I went to buy strawberry via metro. See here. This is the metro. This is the strawberry. These are the leaves. How is the leaves? Leaves are green color. It means this is the cervix and the discharge is what? Discharge greenish discharge. Done. Okay. One thing is done. See here. I went to buy strawberry. I went to buy strawberry via metro. What is why I'm going to buy the strawberry via metro? Because strawberries are very costly. That's why it's costly means what? Culture media is the diamond media. Okay, why I went to metro? Because the drug of choice is what? Metronidazole. Okay, see, and also how is metro is moving? Okay, it means the motility is what, amma? It is the motility is the twitching motility. Done. Okay. Next one is the bacterial vaginosis. See, bacterial vaginosis caused by Gardnerella vaginalis. Here, see here we are having the M cells criteria. We are having the M cells criteria. It includes there is a grayish, whitish, and the pH must be more than 4.7, and there is a fishy order. There is a fishy order. See, fishy order due to what, amma? Due to release of amines, acridine, and putidine. Which is, if there is a fishy order, it means there is a whiff test. It is called whiff test. That is whiff test means what? Whiff test means there is a fishy order due to release of the amines, acrid, and putrid. This is also question. There is a clue cell, that is vaginal epithelial cells joined with the organisms. This is called the clue cells. Okay, these are the answers criteria. Okay, see here. What are the drugs or drug of choice for the bacterial vaginosis? Actually, the standard drug of choice is the metronidazole. But other drugs are such as clindamycin and tinidazole are also the drug of choice. But standard is the metronidazole. In the trichomonas vaginosis, you have to treat the partner also. But in bacterial and the cardiac, no need to treat the partner. And also that in the candidiasis, guys, I think everyone knows DD means this is candidi curdy. Candidi curdy. This is a curdy discharge. See here, the pH must be less than 4.5. Okay. Drug of choice is the fluconazole and the quatremer. Fluconazole, how much? 150 mg. That's it. Types of headache, guys. So types of headache, tension type headache. Everyone knows that tension type of headache most common is the female, and it's like a band-like compression. It's like a band-like compression. It's like a band-like compression with the tension headache. The doctor is the NSAIDs, give PCM tablet or ibuprofen or take rest, take coffee. It will resolve. See, cluster type effect. See, luster. See, lust means what? In males, we are having the more lust. Okay, that's why it is common in more in the male. See here, this one triggered by, see, triggering factor is the smoking and alcohol. See, that's why, see, you have to observe in your friends gang who is drinking alcohol more. Suppose example, he is drinking alcohol at 10 o'clock. At midnight, 3 o'clock and 4 o'clock, I'm early morning 4 o'clock, he will complain that, oh, my goodness, I'm having so much pain. Pain is like uh, someone is like inserting like needles on my head. Like someone is pricking my head. Okay, that is what this is excruciating piercing type. And also there is a retroorbital pain. There is a more pain on the eyesight also. Okay, and also it is associated with the increased tear secretion. See, lust. How is the lust? Is a white color lust. Is this a secretion also? It means it's also associated with the secretions. So, suppose example, your friend who drank well, very high, uh, more pegs at 3 o'clock, at midnight, 2 o'clock. Here he came to you that, okay, I'm having headache. It means, so we went to the casualty room. Then what is the how the doctors are going to treat? First one he will take the history. The history always he will know that, okay, this is the case, the cluster headache. First of all, you have to do the high flow oxygen, 100%. How much? 100% high flow oxygen up to 12 to 15 liters per minute over 30 to 50 minutes. Okay, and also injection sumatriptan subcutaneously, and everything will be normal. Okay, for the prophylaxis gas, it is the CCB. For the migraine gas, I think everyone knows that migraine is the unilateral, most commonly in the female. See here, how is going to the migraine? You see, the migraine has the vascular what? This is the pulsatile. It is the pulsatile. It is the pulsatile, and also pulsatile means what, amma? There is a, you will feel the pulses here. Okay, at the temporal region, when you have the migraine, try to feel the pulses here. How? You see, it is the migraine is triggered by what? Light. And whenever a patient is coming to you at the OPD guy or the OPD for at the chief complaint of headache, first of all you have to ask the patient, is it associated with the light? Okay, on the light, is it your headache is increasing or not? On the like light and also the sound of phonophobia, phono. Okay, like this one, guys. And also it means it is associated with what? It is associated with the associated with the migraine headache only due to depolarizing electrical activity. There is an increase of what? CGRP here. Okay, okay. So what is the treatment for that one? It's a mild to moderate. You have to give the NSAID like PCM and also give aspirin, Disprin, okay, ibuprofen. For moderate to severe guys, the drug of choice is the triptan. That is the triptans, sumatriptan. Okay, now like triptans. What is the mechanism of action? It is the triptans are the what? 5-HT1B and 5-HT1D. Okay, here. Difference are 5-HT1B and 5-HT1D receptor agonist. Example, sumatriptan. It is the drug choice mostly used. But remember, guys, it is contraindicated in the stroke. In the stroke and the heart diseases, you have to not give the sumatriptan. In the earlier days, guys, we are using the methyl ergotamine because of the it causes the gangrene side effect. That's why methyl ergotamine is completely contraindicated. Okay, prophylaxis is the propranolol. For the obese patient with migraine, you have to give the topiramate. Okay, that. And the next one is the, see here. I think ABG. I think everyone knows about the ABG here. See, first of all, you have to know the normal values. Okay, so pH is what? 7.35 to 7.45. So cut to this 7.7, you will get the PCO2. How much? 35 to 45, and bicarbonates 22 to 26. See, first of all, apply the basics. Common sense is the, I think this is the what? This is the pH scale. This is the pH scale. Okay. So this is 0 to 7 here, 0 to 7, and this is the 14. Okay. So 0 to 7, how much? 7 less than 7 is the acidic. More than 7 is the what alkalosis is. Okay. 7 is the neutral. See, if it means it is 7.35 to 7.4. See, the pH is less than 7.35. It means what? It is acidosis. More than 7.45 is the alkalosis. Done. Okay. Next, see, remember, if there is more oxygen in your body, that means what? Oxygen means what? It is going to be acidic. More oxygen, it means acidic. More oxygen, it is acidic. Less oxygen, it is the what? Alkalosis. More bicarbonates cause the acidosis. More bicarbonate acidosis. Less bicarbonates causes acidosis. More bicarbonates causes the alkalosis. Okay, done. These are done. Okay. Remember here, if there is anything changes in value of the CO2, it means it is associated with what? Respiratory or metabolic? Always respiratory. If it is associated with the bicarbonates, it means it is associated with the metabolic. Okay. See here, first of all, what you are doing is a pH. How much pH? 7.23. 7.23 means what? It is less than 7.35. It means what? It is the acidic. See, PCO2, oh my God, it is very high. It also must be acidic. So you have to know that, okay, acidic, that means it is associated with the respiratory. Okay, okay. So check here, what is normal, and the bicarbonate is also normal only. It means what? Respiratory acidosis. If these are high, but see, bicarbonates are not not increasing or decreasing. It means it is not compensating. It is not compensating. It means this is the uncompensated respiratory acidosis. Actually, this must be increased or decreased. Then only it is compensating. Okay. See this. This is the golden rule here is the. See here. If the pH is abnormal, see here pH is abnormal here. There is a CO2 or bicarbonate. If any one of this is normal, it is called as the uncompensated. If nothing is normal, it is called the partially compensated. Okay. Then it is the this is the if the pH only is normal and everything is not normal, it is called as compensated. Okay. Remember this rule, golden rule for the simple. Okay. Next one is the extravasation of the urine. See how I remember for the exam point of view, guys. First of all, remember, guys, in the question, if they says that a patient, suppose a person hit by motorcycle, it means there is a what? There is a membranous urethra injury. If there is a manhole, if the person is going and he fell in the manhole, then it is the bulbar urethra. Bulbar urethra is the most commonly. Okay, so by the history itself, you have to this why he is mentioning there is a manhole, why he is mentioning the motorcycle. It means you have to know. Okay, it means membrane. There is a membranous urethra, bulbar urethra. Okay, so just read this one. Okay, what if in the membranous urethra, where is the urine is going to flow? Okay, just remember this one. I think this one everyone knows about this one. This is the for the CSF where CSF. See, this is simple. See here. See this. This is the viral. Okay. Remember simply viral normal. It means in viral all are normal. Normal except the normal and means lymphocytes. See in the CBC report, if the lymphocytes are high, it means viral only. That's why see here in the viral all are normal except lymphocytes. Done. Okay. The next one is the C here. Bacteria loves to eat glucose. What if bacteria is eating the glucose? It means the glucose must be decreased. Glucose must be decreased. See here in the pyogenic and the TB also there is a what? Glucose is the decreasing. In the CBC reports, if there is a more neutrophils, it means what? It means it is the bacteria. It means it is the bacterial. Done. For TB, guys, TB, what happens here? The TB, in TB, what happens? There is a maximum protein. See here, there is a more than 100 mg, 100 milligram percent of the protein is going to increase. That's why there is a formation of water. There is formation of the cob. There is a spatulite. There is a cobweb formation due to the more protein in the meningitis. This is what you have to remember from that one. Okay, this is what we are going to give. Okay, so this is more 10 minutes to go. Okay, so here, suppose example, guys, if there is a like fungal here, the most commonly is caused by the cryptococcus found by the it is fungal meningitis. Fungal meningitis most commonly caused by the cryptococcus neoformans. Cryptococcus neoformans. What stain we are going to use is the pass. This is a pass staining which will be positive and it will highlighted with the India with the India we will see the clear halo. Okay. Treatment is very important. Amphotericin B plus flucytosine followed by the fluconazole. Okay. See here. Okay. We'll done. Next one. This is the last part. Okay. Last but not least. Okay. Done. Here is the BPH and the prostate cancer. See here the BPH. If you see BPH is mostly common seen in the elderly or if the age is more than 60, 70, 50. Okay. Then also there is a high chance to get in the BPH. That is the benign prostate hyperplasia. The name is not a tumor. It is a benign prostatic hyperplasia seen in the mostly in the 80s. Okay, in the elderly. What are the most common symptoms? The increased urine frequency, and there is also the increase in frequency, and also there is a increased urine retention. Okay, the patient will feel he will getting urination sensation, but when he go to the bathroom, but he will not get anything. Okay, na? And also there is a, but the urine will fall drop by drop sometimes. Okay, na? See, BPH, see, we have in the total two zones now. Okay, so this is the transition zone. This is the peripheral zone. What is the most common zone involved in the BPH? It is the transition zone. While coming to the prostate cancer, right? It is the adenocarcinoma type of cancer. Okay, now it is seen in the peripheral zone here. Okay, now then what is the main enzyme here? This is the what is the main androgen here? This is the DHT androgen. This is the DHT androgen. Here, the main enzyme is the acid phosphatase is the elevated here. See here, actually, what happened? Testosterone. So testosterone is converted into DHT. Testosterone is converted into DHT with the help of enzyme called as 5-alpha reductase. This is the 5-alpha reductase. This is the 5-alpha reductase. Okay, what is there is here something happen in the 5-alpha reductase? It's going to the more DHT. More DHT will causes the what hyperplasia of the prostate gland and also causes the constriction of the what bladder by help of or help of detrusor muscle. Okay, now on that, see, on the DRA, digital rectal examination, what is there is a rubbery, there is a foam rubbery prostate because our prostate is mobile here. Here on the DRE gas, what are the findings here? Findings here, there is hard, there is a hard nodular and the mucosa is fixed here. Okay, done. See here, treatment is very important here. Medical is the what? Tamsulosin. Okay, now tamsulosin will act on the what? 5-alpha reductase and it will and this will what? It will act on the detrusor muscle to relax, and that's how the urine will be what? Pass out. Okay. See, if there is a hypertension and BPS, you have to give the prazosin. If the patient is for symptomatic treatment, you have to give the tamsulosin. Treatment is the what? TURP. TURP treatment transreductal relation of the prostate here. For the irrigation fluid, you are using acidotic and glycerin. Most common complication is the retrograde ejaculation. For the post-surgery irrigation of clot retention, we will do with the three-way Foley's catheter. Okay, so please read this. Come to the cancer, we have what scoring here? Gleason, okay, Gleason scoring. Tumor marker, PSA tumor marker, surgery water, radical prostatectomy, but the most common complication is the impotence. For the radiotherapy, we are using what? Iodine 125 here. Okay, just read all this one. 5 minutes more to go. See here, I think everyone knows about this one. Trichophyton, microsporum, epithelium fiber. Just try to correlate with the images here. Okay. The next one is the defects of the brachial plexus. Defects of the brachial plexus. The first one is the obstruction palsy. Next one, clunky pulse. Next one, wing of scapula. I think everyone knows about the wing of scapula. See this injury to what? A long thoracic nerve. What muscle is paralyzed? Serratus anterior muscle paralyzed. Which border of the scapula become more prominent to the medial? What is the medial border? It's the medial border. Done. Okay. See here, Op's densest palsy. It is due to what? Due to the most common cause is the what? During the shoulder dystocia. Shoulder during the birth, if the shoulder is not coming, if you are going to fully forcing to coming of the baby, then it may cause the shoulder dystocia. That's why you have to perform the Janimally maneuver. It means push out the baby and you have to do the LSCS. See, what is the nerve node? Is the C5, C6, here the C8, T1. Okay, see, what are the main nerves what are the main nerve is going to involve here? Remember here, see, I'm going to make it, I am going to make it simply clear cut. See, this is the clum kiss, this is the clum kiss palsy. See, clum kiss, clum, see, clum spelling here, UM. It means main nerves are ulnar and median. Means ulnar and median. Okay, now what are the main nerves involved in the clump palsy? It is the ulnar and median nerve. Okay, and remaining nerves just keep here. Okay, now in clump just keep ulnar and median, and all these through here. Okay, so in the OPS policy, yes, which no root, this is the main important, and this is not very, very important. I think this you know this how the patient is going to present. It's also called a policeman tip hand. Okay, remember this one. And coming to the clumsy policy, there is a claw hand, there is a complete claw hand. Okay, so what major paralysis? It is the lumbricals and the interstitials lumbricals and the contractors are going to paralyze. That's how we are going to get the clumsy paralysis. Okay. So guys, hope you guys got it. Okay. Thank you very much. So thank you very much. We'll see in the part 2.